Hi, my name's Leanne Shannon and I'm an oral health therapist at Woolloongabba Oral Health Centre. I work here full time, and what usually happens is the dentists that work here will refer adult patients to see the hygienist, which is myself and several others that work here, and we will go through how to look after your teeth in order for them to look after your mouth as a whole. So when you come to see the hygienist, we will assess your mouth, have a look around, and if we just need to work out then a plan for what we're going to do. But ideally, after that, we've decided whether or not you can be at risk of dental decay in your teeth, or some people can be at risk of gum disease. So with dental decay, that's influenced a lot by many factors, including a lot of sugar in the diet. Gum disease is influenced a lot by how much plaque is lying around the gum line of the teeth. So we'll have an assessment of the mouth, decide what we need to focus on, and then give you a treatment plan to follow, and we'll work out our appointment scheduling as well. If you have any concerns about your dental health, or if you're concerned that you're not brushing the correct way, or you're doing something that you think is detrimental to your teeth, you're certainly welcome to come to our clinic, and we'll follow everything up for you and make sure that you've got all the information and correct advice that you need. And certainly for all toothaches as well, they're most welcome to ring here to get any toothaches seen to. Hi Danielle, so can you tell me how many times a day you brush your teeth?
Once a day.
Once a day? Do you know that it should be twice a day? After breakfast and before you go to bed? Which one are you managing to do?
Nighttime.
Nighttime, before you go to bed. Okay, so we might try and increase that before you come in to see us next time, so that we're making sure that you're doing after breakfast and before you go to bed at night. Are you doing any flossing at all?
No.
No, okay. But we're going to change that habit, aren't we? And get into the habit of brushing every day. So what we might do today is just start trying to change a few habits at home. So yeah, just give yourself a bit of 5 extra 10 minutes a day just to get out the door, brush your teeth before you head off. Because otherwise it's a long time in the morning till when you get home brushing your teeth at night time. Yeah. So the first habit we're going to try and change is brush twice a day. Yeah. And then what we'll also do is try to change the way that you brush to make sure that you're doing the correct technique. Okay. So when you brush your teeth, you're going to angle your toothbrush up. Angle it up 45-degree angle, and then you're just going to do a couple of teeth at a time, but you're doing small circles. Okay, so 45-degree angle around the top. Sometimes it's easier to close your mouth at the side, and then we angle the toothbrush back, coming back this way, 45-degree angle upwards again, small circles, making sure that you can feel that plaque being moved from around your gum. Okay, then we come back on the inside and we're going to angle it up 45-degree angle, then coming back again and doing this side, coming back, making sure that we've got all those surfaces on the inside as well. Okay, then shifting the toothbrush down, placing it against the tooth, angling that 45 degrees down again, and we're going to do the bottom ones so that we're cleaning down around the margins of the tooth, of the gum down there. Then coming back again and doing this side all the way around to those back teeth, and then we're going to shift the toothbrush onto the inside, angle down 45-degree angle, and then come all the way back again. Sometimes the tongue will try and force the toothbrush out, but you've just got to try to get that toothbrush on the inside of those lower teeth. Okay. Then after we've done that, we come back along and we clean the biting surfaces. So the grooves of the teeth will also collect plaque and bacteria, so we're wanting to clean those areas out as well. So we do the bottom ones, then we do the top ones. Now you mentioned that you didn't floss as well, is that right? At least once a day, preferably night. We're going to grab a bit of floss, so 3 fingers, wrap that around, hold it like this, yep, and then you seesaw the floss down each side of each tooth. Okay, so it's sort of like a seesaw motion, backwards and forwards, down there. So the flossing is removing all the plaque from the in-between surfaces. Okay, these are all the areas that the brush can't get to. So Danielle, another way that we can brush our teeth even more effectively is the introduction of an electric toothbrush. Have you ever seen one of these? No. So the idea of the electric toothbrush, the round head that moves the plaque around even more, around the gum line. So if we angle that onto there, make sure it's a 45-degree angle, and then flipping over onto the inside. So if you can get a hold of an electric toothbrush, that's great. If you can't though, the manual toothbrush. Okay, so we're going to change some things now. So what's the first one?
Brush my teeth twice a day.
Perfect. The second one?
Floss every day.
Every day, yeah. And third, just changing how you brush a little bit.
Technique.
Okay, great. We'll see you in probably a few weeks just to make sure that we check how the cleaning's going, if you've got any problems, and we'll take it from there. Okay.